Well, welcome back to Dr. Kyle and Dr. Aaron here at Simply Health Chiropractic. We got to call our show a name here pretty soon if we're going to keep doing this weekly.
I know. 2
chiros and a question? I don't know. Anyway. Hey, last week we were talking about neck pain and how it's established, how that's affected, and chiropractic care and what that does to assist in correcting neck pain, eliminating, reducing that. And we told everybody this little surprise this week, so hopefully people are jumping on, probably clamoring on to see what we're doing. And the topic for today is
review.
Yeah, we like to just review. We've done a few topics lately, and so we thought it'd be a great week to do a review. Next week we're gonna have a little surprise again.
Right.
And actually, even the next week after that
is a surprise.
Is another surprise. So keep jumping on and tuning in or watching. And we got some fun things for people to kind of connect with if they're keeping track of our live events.
Right.
So we've talked a lot about upper cervical chiropractic.
Correct. What
that means and how it can kind of relate to assisting the body to heal.
Right.
So
we have a friend of ours here with us today. Maybe this is our surprise.
Well, it could be our surprise review, and surprise we have a friend.
We have a friend.
Yeah, Dr. Aaron took this guy this morning.
Right. It was a little messy, but we got it cleaned up. So when we talk about upper cervical, what we're talking about are these 2 top neck bones. This is the full spine here. But we focus on these top 2 neck bones right here, because if we turn around, I don't know how well you can see, this little yellow guy come down the middle. That is the spinal cord, and you have all your little nerves coming off here. But we focus here because that's where the brain extends out of the base of the skull into this area. And we focus there because that controls every cell and function in the body.
Yeah, so it's interesting to know that the spine itself is set up to protect the spinal column, and then the base of the skull, the whole skull, is there to set up to protect your most valuable asset, your brain stem, and the spinal column itself.
Right.
And so the interesting thing to note is that all these other joints, all the other muscles that connect with these joints, have multiple connections to the spinal column itself, but the top 2 neck bones do not. Their only connection, the muscles that control these bones, are their only connections coming out of here. So when we have these joints misaligned, there's a problem even connecting to the muscles surrounding those joints. And they are the most freely movable joints in the whole spine. They're the ones that let you nod your head and turn your neck the most.
Right.
All the other ones are there to support that, support the structure. And yes, you're twisting and turning, but all of these have combinations of movements, whereas turning and nodding of your head primarily is functioning from the top 2 neck bones.
Right. So a little bit more about what upper cervical is. There we go. So the other thing we've been talking about is headaches and migraines.
So that was our first topic about headaches and migraines, and there was some staggering, even surprising information about headaches and migraines.
That 39% of the U.S. population suffers from migraines.
So I think that's 39 million.
39 million, yes.
Yeah.
Sorry, I left out the million there.
Well, you went to percentage already, but that's
oh.
like 1%. But 1%, 39 million people, that's the population of California.
Or Canada.
Or the population of Canada. So, I mean, really, if we're thinking about it, if everybody in one location, according to our statistics, had migraine, it would be all of Canada or all of California.
Maybe we should move.
Everybody would have a migraine or headache, right?
Right.
In that sense. So that's a lot of people.
1 in 4 in the U.S. So if you're 1 in 4 have someone in their home that suffers from migraine.
So 1 in 4 households have a migraine sufferer.
And so if it's not your house, and it's probably one of your neighbors, and not them, maybe you should get to know neighbors at least.
Get to know your neighbors 2 doors down, and if they have a migraine,
let them know about us.
Yeah, they should be knowing about upper cervical chiropractors.
Even if you're having a family get-together, someone there must, statistically, probably suffers from migraines.
Right, exactly. And that's not all. I mean, about our hospitals are flooding with people with headaches and migraines.
Every 10 seconds.
Every 10 seconds,
Every
someone's
10
walking in
seconds.
the hospital
Right.
with a headache and migraine scenario.
Right.
And really, that seems like a lot.
Right.
I mean, seeing how chiropractors actually have a great solution, especially upper cervical chiropractors have a great solution for headaches and migraines.
Maybe we should get a job in the emergency room.
Right, or yeah, maybe they should be recruiting more upper cervical chiropractors. But at the same time, that seems like a lot of people going to maybe get something to relieve pain or symptom that could be easily managed
Right.
by a good upper cervical chiropractor.
And then when you do go to the emergency room or to your medical doctor, a lot of times they're just giving you a script
Right,
to take care of it, when we can go and find and address what is causing those migraines. And it's fun to see someone come in and be like, yeah, I haven't had a migraine in about a week. And you're like,
yeah.
and some people, that's amazing for some people, even a month, even in the future and stuff like that. But
Right. Well, we've even had clients who come in after they've been in care and they go, it felt like a migraine was coming on, then it just went away.
right,
Because their body's able to heal it, able to function the way it's supposed to now,
right,
rather than simply, I have the migraine's coming on, the body doesn't have any way to stop it, it just comes on.
right.
I think our next topic, one of our next topics we just talked about was neck pain, and very relatable to what's going on with the neck,
Right.
upper cervical chiropractors,
Yeah.
headaches and migraines even.
And the big one, surgery. When should you have surgery on your neck? And what we said last week is 90% of all neck problems that people will probably have surgery for could have been solved naturally with a different approach.
Yeah.
And that's a huge number, that only 10% of neck surgeries really need to be done.
So, personally, in my own mind, my personal opinion, when should have neck surgery? Unless you're in a severe car accident and you're brutally mutilated,
Right.
never.
Never.
Yeah.
I was even bringing this up with nurses and people who've worked on these floors for the back surgery, neck surgery floors. Are like, I will never have neck surgery, or they're going to be like, or back surgery, or I'm going to wait till there's nothing else. I'm going to exhaust every one of my options before I have that. Just because I see those people right after surgery, how it's affected them, doesn't always fix the problem.
Right, and we talked about the side effects of neck surgery.
Right.
One of them is literally chronic neck pain,
Chronic neck pain.
and the second is failure to heal. I mean, I don't know about you. That seems just too big of a risk for actually trying to solve a problem that hasn't been really solved. Not to say, and we're not saying that surgery is a bad thing, and we're not saying that surgeons don't have a good place, and we're not saying medical doctors aren't awesome. We're just saying we're probably using the wrong tool for this problem.
Right.
We
So-
talked a little bit then about concussions and how that is effective, and how upper cervical chiropractors have a huge role to play in concussions
Right.
and rehabilitation of concussions, because a lot of concussions, trauma to the head means
Neck trauma.
neck trauma, always, undeniably.
Because isn't it almost double the force to the head? Well, I mean, the force to the head is double that of what is caused.
Yeah, and
from
actually,
neck.
I think that what we're showing is it's 4 times.
Four times.
The research is showing that whatever trauma you got to the head, times that by 4,
To the neck.
that's what you're going on to the neck.
And so if someone's already had a concussion,
Yeah,
they've already had neck pain.
right.
And just because you got hit in the head doesn't mean you didn't get a concussion that you didn't receive neck,
Neck pain, right.
Or neck trauma, sorry.
Yeah, exactly. Neck trauma. That's not necessarily neck pain, but neck trauma itself.
Right.
And it can be very insidious. I mean, we even have clients who come in with head trauma. Their neck is not hurting, but the neck is the problem. And it's funny
Right.
enough, we unlock and make a correction in the top 2 neck bones, and then the head pain goes away.
I just had something pop in my head where we did talk about ADD and ADHD, but it's like, I think of my youngest daughter, I think she's like double the amount of time someone could fall at her age. She's always fallen.
Right.
Not so much now, but when she was a kid, she's the youngest of 2 crazy kids. Got knocked down a lot, and who knows, she could have had a concussion sometime in her life and not getting it treated properly.
Right.
Maybe that turns into ADD, ADHD.
That
or
could be.
just because you hear about like the famous football player Vince McMahon.
Right.
If I'm correct, he would play for Chicago Bears, and I think Utah people know he played for BYU. And he was a pretty crazy person after football was all said and done, and finally he went to an upper cervical chiropractor.
That's right.
And he even said there that his mood and temperament were different. So it's just amazing how much those repeated traumas, those concussions to him, how it affected him, that post-concussion syndrome.
Yeah, so again, increasing not only the ability to heal, but the ability to function the way his body was supposed to. And it's amazing the connections that happen through that brainstem that's being affected by that little bit of pressure. We call subluxation, not to be confused with the subluxation in the medical world. Our subluxation is a joint locked out of its range of motion, putting pressure, irritation on a nervous system structure. Right. And we were showing that the weight of a dime can decrease nerve function by up to 70%. Right. And so that's a lot of pressure. What if it's more than the weight of a dime?
Sometimes I think it'd be more than a weight of a dime, because really that's not a lot of pressure if you think about it.
It's not. Put a dime in your hand and just see how much.
It's like, imagine we don't carry change around too often anymore, but we have like quarters and nickels, and we don't jingle. Well, sometimes it's cool to have a little jingle.
I guess. At Christmas time.
But even like say carrying around your keys all day, that's more than a dime.
Yeah.
Just imagine not. So it's just crazy that just a dime.
Yeah.
Just that. Even I tell people, and it still boggles my mind, that just a dime.
Yeah, and I just can't stress enough the importance chiropractors, especially upper cervical chiropractors, play in the role of concussion and the cervical rehabilitation. We're finding out more and more and more that the brain trauma, not so big of a deal lots of times.
Right.
It's the neck trauma, the connections you make between your brain and the rest of your brain travel through that brain stem. And if that's not healed up and properly corrected or rehabilitated, then sometimes those connections are lost.
Right. And we talked about neck pain, jumping down to low back pain.
Yeah.
We found that research was showing that a lot of people have disc bulges.
Right.
That heal themselves.
That heal themselves spontaneously.
Right.
And have no trauma whatsoever. In fact, I may be going to mess up this study, but there was a study done with the military, and I think it was Korea, South Korea, somewhere in there.
Right.
And they wanted to prevent back pain in the military. So they took all these military personnel and they did like an MRI or a CT scan, I can't remember, but they did an exam, right? And they found that quite a huge percentage of them had a bulging disc with no pain.
Right.
And so they did the study again a couple years later, or a couple months later. I can't remember the time frame off the top of my head. We're going to look that up. Anyways, they did the study again. They found that almost 80% of them had spontaneously resolved, right? And that other ones may have, for other people, had spontaneously appeared.
Right.
And so their results were, disc bulges don't do a lot of problem. People just spontaneously have them and spontaneously get rid of them. And
I think a lot of people, the big misconception is that, oh man, I have a pinched nerve, my leg hurts and all this stuff. But we discussed before is that a pinched nerve doesn't cause pain.
Right, pinched nerves do not cause pain. Yeah, most pinched nerves actually cause numbness or tingling. They do not actually cause a pain sensation.
Right.
Very few nerves actually in your nervous system actually perceive pain.
And that's 11%, correct?
17%, I believe, but 11% of those are in your skin and muscles.
Okay.
And so if you're having pain, chances are it's either a muscle or skin or the surrounding, something surrounding a bone, like the periosteum.
Right.
So there's very few of these nerves that actually perceive pain. Most of the time, if you're having pain. So it behooves us to really figure out what is causing these pains versus what is, causing a bulging disc. Right. And we get that a lot. Actually, worked for in the X-ray rooms at Palmer College, and where we both graduated, Palmer College. Shout out to them, Palmer College. Standing beside and hearing Dr. McLean down there all the time to say, well, that's a disc bulge, but do your tests before, do your studies before, do your orthopedic and neurological tests, and then confirm it on the X-rays or not the X-rays, the MRIs and the CTs. many times I feel like many times we want to go look for something,
Right.
and if we found it, we're like, oh look, see, there it is. It's a disc bulge. It must be what it is.
Right.
But many times that's not the case.
I think there's always that risk-benefit ratio, and I think they put a little bit too much of a benefit on MRIs whenever they don't do the tests to figure out.
Yeah, there's very simple tests to kind of figure out and have an inkling that there is a disc bulge happening versus anything else.
Right.
We moved on. Doing that low back pain though really helped. But one of the earlier topics we talked about was kids in chiropractic.
Right.
And should you get your kids adjusted?
Right. And yes.
Yes. Yeah, of course. Of course you should. Of course.
It's, and the thing is, I think a lot of people, when they think of chiropractic, they think kids getting their neck twisted.
Yeah.
But we don't do that. We are very systematic in how we address the neck and make sure we're doing the right correction for that person, not someone else walking down the street. We're not going to do his adjustment on you. We're going to use the adjustment specifically for you. But with kids, sometimes it's little pressure and that joint will just move, and it does almost the weight of a dime. I don't know.
Well, it takes very little in many
Right.
cases for children, and I think it's worth getting kids checked. And I'm going to backpedal on my words because I said adjusted.
Right.
But really, what we're saying is get your kids checked by a good qualified chiropractor that does know
Right.
kids and knows how to adjust kids. In the sense that getting them checked doesn't mean they get adjusted.
Right. They may not.
Yeah, it may not. I mean, you go to your dentist and you don't have cavities, does he pull out the drill?
Some people hope he does. I don't
Yeah,
know.
I don't know. I hope he does it, right? I
Right.
hope he's thinking, oh gosh, this guy's got good teeth. Way to go. Get out of here. Well,
Let's mess him up so I can make more money.
Right? Yeah. Hopefully not.
Hopefully not.
Hopefully not. Well,
But-
hopefully in that case, that when we're checking not only kids but adults and teenagers and all walks of life, that if you do not need an adjustment, hopefully you're not being adjusted.
And there's that research, I can't remember if it was done out of Germany or Italy, where they tested all these babies when they were born.
Yeah, in Germany.
Germany. And they found that 80% of all childbirths, there was some sort of neck trauma.
Yeah, some sort of cervical trauma, and one of the recommendations was go see a chiropractor, get your kids checked,
Right.
2 weeks after birth, to see whether or not they need to be that needs to be addressed.
Right, and you see a lot of kids who have problems like, we had, unfortunately, a little baby was in a car accident, came in, and they
Yeah.
were, before the accident, was a great feeder, great sleeper.
Right.
And they brought him in. Man, as soon as we got done adjusting, he was eating better, and he fell asleep right afterwards. So it's just...
Yeah, we have handfuls and handfuls, and I'm sure there's other chiropractors with handfuls and handfuls of examples of kids who have come in either crying or won't eat or won't turn their head a certain way. We've had all those examples in our office, and I am super excited when somebody brings in a child and we're able to make that correction. And, it's just magic on the table many times. So.
And then that goes into that ADD, ADHD, which we have been talking about. And,
yeah.
And sometimes, it could be something, who knows, a trauma earlier on in life from all the million times that they fall.
Well, and you'd think, I think that the perception, my original thinking might be, if a child's got too much energy, that means there's tons of electricity and the brain's working overtime and stuff like this. Well, the brain works on signals.
Right.
And the nervous system works on signals. And there's two types of action potentials, how the nerves fire, right? There's enough signal and the right kind of signal.
Right.
So if you're changing the signal, we're not talking about necessarily decreasing signals. We're talking about pressure and irritation on a nervous system. We could be changing signals by pressing into the soft tissue, right? Or diverting signals. And so, yeah, if we change that signal or even diminish it, could that be the signal for ADHD or ADD? Could the change of signal be hyperactivity?
Right.
And so a lot of times I think we get confused. But my personal idea is a lot of the times that is the case.
Right.
That when that pressure irritation is going on the brainstem, it's changing the signal for these kids, and the signal is hyperactivity. The signal is more energy, them put out more and stuff like this. Which is interesting because a lot of ADHD kids get told to drink caffeine.
Right.
And why is that? Because it calms them down. Well, caffeine is a neural stimulant.
Right.
Wouldn't that hyper them up?
Right.
Right? Give them more energy, or at least more constant energy? Which is another reason why I think ADHD has to do with changing the signal rather than it being the actual signal. Because when you add the caffeine, the nerves are now able to stimulate properly, and the child's able to calm down. That's just my theory. Somebody take that and study it. Let me know if it's true, and I'll put my name on there too.
All right. And the last one we talked about, Parkinson's, MS, cerebral spinal fluid issues. We have that fluid around the brain and spinal cord, like we were talking about, to protect it, our most valuable asset for our bodies. And so what happens is that fluid is not able to flow the way it's supposed to, get that nutrition to the areas it needs to. We have problems.
So what they're noticing in research, especially in Italy, doing a lot of research in Italy.
Italy's that one.
Yep, and they're noticing that there's the reason why we're getting these finger-like projections in the brain, which is how they diagnose multiple sclerosis, is the protein concentration is saturated, and so there's nowhere for the proteins to go rather than back into the brain, interrupting brain processes. And part of that is they believe, and I think that's what the research is kind of showing, is that the part of that is the cerebral spinal fluid, the stuff that your brain is bathed in, is not draining properly. There's a kink or a pressure or something in the system. Upper cervically.
Right.
So you get that when you get that little neck bone, kind of turned a little bit and stuck there. That doesn't only put pressure on the nervous system or the brainstem. I mean, you could be cutting off some blood supply, but also cerebral spinal fluid. It's that fluid that drains out around the spinal cord and the brain and bathes the spinal cord and the brain in. And so if you got that fluid blocked off, it leaves that proteins up there.
Right.
And guess what they found? When you make an upper cervical correction, the fluid drains properly, right?
Right.
Now that might be also nervous system and blockage of the canal for the spinal fluid to drain. And guess what happens to the symptoms of MS?
They decrease.
Yeah, they're decreasing. They're finding that they decrease. And I don't know if that's every case, but as far as I understand, that's most of the cases for that, for multiple sclerosis.
Right.
So we kind of had some inklings that maybe multiple sclerosis is not really multiple sclerosis. They've even found that even the tonsils, there's a couple of tonsils under here in the brainstem, and sometimes they fall down in here, right? And they can pinch off again the cerebral spinal fluid flow and the nerve and the brainstem and all sorts of stuff. And guess what they found again? When you adjust that top neck bone and it's in the correct position, those tonsils just kind of bounce back up. Right? And they call that Arnold-Chiari syndrome. And so one or both tonsils could be falling down there depending on how far they go. And that is incredible that they're kind of learning this. Upper cervical chiropractors have a huge role to play, and we're not well discovered, not well founded in the populations, but we're out there.
I think it's an interesting thing that both of us, when we went to chiropractic school, wasn't even our direction we wanted to go.
I didn't even know what an upper cervical was. In my opinion, I didn't even know hardly what a chiropractor was really. But but when I found out and I figured it out, I changed my direction from sports chiropractic into upper cervical. Right,
and I was just going to be a general chiropractor because that's everyone that I had seen before. I'm like, well, I guess this is what it is, and then and now I'm like, man, this seems a lot more easier,
right?
Because it's just so specific and just addressing that one area and the results from there.
Yeah, and I think we get to mention the big underlying factor for everything is chiropractic is not curing these things.
Right.
Chiropractic addresses one problem, and that is subluxation.
And that joint locked out of its normal range of motion, putting pressure on the nervous system.
And when we unlock that, it is amazing what is going on. And the reason why we're affecting so much is because we are affecting the brain stem, the spinal column, the cerebral spinal fluid flow, even blood flow, and allowing those to flow freely so that your body can heal the way it's supposed to, have that connection to its brain, And it sounds, even when I say it now, it sounds voodoo-ish.
Right.
That your brain has to be connected to every cell and function of your body.
Right.
You know, and vice versa, right? Your tissues talk to your brain.
Right.
And when that connection is clear, your body heals the way it's supposed to. And when it's not clear, that's the first thing you lose, is healing.
Right.
You lose healing.
So, it's fun what we do.
Yeah, so we're having great fun. We're excited to have fun. So.
Right, and the results that we get, I couldn't imagine doing anything else.
Right.
Just because what little we do, and the most effect that it gets, it's the bang for your buck.
Biggest bang for your buck by far. So, anyways, I'm again Dr. Kyle Dury with Simply Health Chiropractic,
and Dr. Aaron Underwood, Simply Health Chiropractic, down here in southern Utah, St. George, Utah. Again, we always say that if you're out of the area and you're looking for an upper cervical doctor, the technique we use here in this office is Blair Upper Cervical, but there are other upper cervicals. So you can either find a Blair chiropractor guy by going to blairchiropractic.com.
Yep.
And searching there. Also, you can go to UpC Spine if you want. There's not a Blair doctor there. They can expand your results a little bit more. Or use Google, type in Upper Cervical Chiropractic, and
see if you can find someone in your area.
And if you have a chiropractor and you can't find one, you can always call one and say, hey, do you do upper cervical?
Yeah.
And if they say no, be like, do you know someone who does?
Right? Ask them for the referral.
Right.
If you're having trouble finding, you can always call our office, though,
Right.
435-688-0444. If you know anybody with what we've talked about in the last few weeks and reviewed today, please call the office, 435-688-4444. If you mention this video, we'll do a free consult and a free spinal screening with you and see if there's a good connection. And hey, sometimes there's not, right? Sometimes we don't handle it. It's okay. But more often than not, our statistics show about 80% of the population does have a problem here, pushing a little pressure into the brainstem, just decreasing that amount of healing. If you'd like to feel that difference, then come on in and we can get you instantly healing better, which leads to
feeling better.
Later, yeah, maybe later. Could be instant, could be later, whatever it is. Anyways, thank you very much for listening. And next week,
we have a guest.
We're going to have a guest. So
we'll have to make some more room.
They have to make a little more room in our little spot here. We're bringing in Stephanie Parrish, who locally is using hyperbaric oxygen therapy in her office, as well as light therapy, as well as infrared. I was going to say also magnetic blanket healing as well. So let us know, and we can get that taken care of for you. And we're going to have her next week. Yes, so talk about that. Yes, talk about all that. So thank you very much for your time.
We'll see you next week.
Thank you. Bye.